November 12 marks World Pneumonia Day, an annual global initiative established in 2009 to raise awareness about pneumonia, the world's leading infectious killer of children under 5 and a major cause of death among adults, claiming over 2.2 million lives annually. For 2025, the official theme is Every Breath Count, Stop Pneumonia in its Track. This theme, announced by organizations like Every Breath Count Coalition and supported by WHO and UNICEF, emphasizes urgent prevention strategies such as vaccination, improved nutrition, clean air access, and equitable treatment to halt the disease spread, especially in low-resource settings where risks like malnutrition and pollution are high. Dr. Bola Shogbeson, a consultant pediatrician, gives us insight on how to combat this deadly disease.
My name is Dr. Bola Shogbeson. I'm one of the consultant pediatricians here in Ifakojai. In a simple layman language, it's a disease that primarily affects the lungs. I would not allow one to breathe very well or cause a difficulty in breathing. Now that can be because of germs, bacteria, or viruses. So they would go into the lining of the lungs and affect the way the oxygen is transported across the lung cells. So physically, it causes difficulty in breathing. So you have very fast breathing and labored breathing. And also because of the infection, depends on what is causing it. It causes a fever. It causes an increase in temperature. Well, Nigeria can actually do a lot of things. We can actually end child pneumonia, especially child pneumonia, by 2030. A very ambitious goal, but achievable, easily achievable. So I think what we need to do is scale up our interventions that we have so far, involve families, to let them know just what to look out for with pneumonia. Like I said, it's a problem with the lungs, affects breathing. So when these mothers or carers know what to look for in the babies or the children they are looking after, it's easier for them to seek help. And when they're seeking help as well, we need to talk about their health-seeking behaviors, because some of them would usually go to the odd neighbor who doesn't know more than they do, or to healthcare workers who are not that experienced. But coming to the right place, the health centers that are open for them and hospitals like this make things easier and faster. So it's achievable. Apart from stepping up the hospital, stepping up information, making sure drugs are available where they need it, ensuring that the information is there. Because pneumonia is airborne. And what I mean by airborne is that the agents are in the air, so it can be breathed in. So if there's contact, improving ventilation, indoor ventilation helps a great deal, As a nation, we need to, first of all, upgrade our healthcare facilities to make it achievable, accessible, and affordable for every single person who comes in, from the primary health centers, basically. So that the initial, like the mild pneumonia that can be treated as an outpatient, on an outpatient basis, can be sorted straight away. That's one. The second thing is, for those who are treating them, adequate education. Our healthcare extension workers given the adequate education they need. Apart from these healthcare extension workers, the mothers will know what to, with public health education, they know what to look out for with these children. Like if you have a baby who has a cough, who has very fast breathing, and who on looking at the chest has enjoying or has a lot of struggle with breathing, they know that, look, it's time for me to seek help. So when they go to the healthcare workers or they go to the health centers or come to the hospitals, they have what's available. Yeah. But Harmattan per se doesn't cause pneumonia. A lot of people are wary about the cold air. But the one thing about Harmattan now, why there's more of a preponderance or more of an incidence of pneumonia, is that the air at that time is quite dry. So the dry air will actually irritate the airways anyway, cause a bit of inflammation and make them more susceptible to infection. But apart from that, like I said, pneumonia is airborne. The particles are in the air, they're in the dust. So dust can carry all these bacteria, they can carry the viruses, they can carry the causative agents of pneumonia. So that's why there's a bit of more preponderance there. Mothers, we go back to the basics. breastfeeding. Breastfed babies are healthy babies. More adequate nutrition. Breastfeeding gives the adequate nutrition they need to avoid these illnesses. So optimal breastfeeding, and where breastfeeding cannot be sought, the right amount of food, We have national agencies who are into pediatric feeding, who have supplemented food that can give these children that will be wholesome for their bodies, Also, to their health-seeking patterns, just to know to get to the qualified healthcare assistant first than going to the odd neighbor or to the odd chemist or to the odd traditional birth attendant who would actually take the money they're meant to spend anyway. And by the time they come to the hospitals where they need to spend money or where they need to do some things, they're already, they've already gone far. So the health-seeking pattern, knowing what to look out for. The child who's got a cough, who's got runny nose, who has a temperature, and also has chest injury or is difficulty in breathing or is vomiting a lot. These are signs that they would have been taught. Like I said, the health education, once they know what to look out for and seek prompt help. And also, make sure that the children have adequate, well-balanced nutrition. And also to make sure that the vaccinations, because when they have children, for instance, over here in the Fakojai, we go through the vaccination schedule for them so they know to get the vaccinations. This is very important because there's a pneumococcal conjugate vaccine, which is part of the vaccine, schedule that it gets, and also the hemophilus influenza, which helps to prevent it. So when they optimize the vaccination, they know the right places to go, they know the right food to give, they know what the clinical signs to watch out for. Yeah, that helps with the mothers. Yeah. We have outpatient care where they are seen in the hospital on an outpatient basis. They come in, the doctors examine them. We have inpatient care for those who can't go home with oral medication, for instance, oral antibiotics, and have to be admitted for intravenous medication. We have inpatient care for them. We have the vaccination clinics, like I told you. The vaccination clinics are good for the preventatives because they get the pneumococcal vaccine, they get the hemophilus influenza vaccine amongst the schedule of immunization for the year. We have the healthcare extension workers who go around to ensure that they're giving education about ventilation, hygiene, personal and general hygiene. And we'll have our updated health center facilities, the basic ones that they will go to first. So there's a lot of care, and that's why I know, even though albeit ambitious, is achievable by 2030 for our country.